Hi, good evening, everyone. Can you please confirm whether the audio and video is fine so that we can start this session? Hi, hi, Akib. Hi, Karan. Hi, Priyanka, Tanu, Lalita. Hi, everyone. Thank you very much. And it's always a big pleasure to share screen with Dr. Thameem. It's been a long time, I think 2, 3 months that we are sharing the screen together. Welcome, sir, and a very good evening to you.
Good evening, Rajat. Always a pleasure to be with you too.
Sir,
And
I
good
have a
evening,
very, very
everybody.
big problem. A very, very big problem. I want to tell this to you that it takes a lot of effort for me to lose half a kg weight. But whenever I attend a session with you, I mean, out of joy, I gain half a kg weight. So, I mean, next time you have to make sure that I should do something for my weight. Yeah. So, okay, guys. So this was a demand that we were getting from lot of the students that they have completed their course. 5 months are left for the exam, and they want to hear from the master, none other than Dr. Thameem. So you will hear less from me in this session and more from Dr. Thameem. And I am more a devil's advocate who will be asking your questions from sir that how you can utilize your 5 months in the most effective way. So please feel free to put as many comments as you can, whatever doubts that you have. I have already collected few doubts that the students have, and I will be taking up those doubts. But please feel free to put any doubt that you have in your mind for if you are preparing for NEET PG 2025 exam. Next 30 minutes are gonna be golden minutes for you. So please don't miss these 30 minutes. So, sir, first of all, an official welcome and thank you for accepting this request from your busy schedule to join for this particular session.
Thank you. Thank you so much, Rajat. Always a pleasure, as I said. The feeling is mutual.
Yeah. So, sir, before I start getting question from the student, I have a very standard question for you. The exams are coming up. Lot of students have a challenge that they are getting too many negatives. They did not score pretty well because of the more negative. What do you think? How many questions a student should attempt in the exam?
So this is got a very nice answer, Rajat. I mean, in the sense we have worked out the mathematical probability of this, and I think we've got good experience also behind us now. Almost 25 years for me, and I think you also been teaching for 20 years now. So what I can tell you here is, see, whenever you go for an exam, and let's look at the NEET exam first. In a NEET exam, any preparation, any mental thing like I'm going to answer so many questions or I'm going to have that questions, generally not a good strategy. The correct approach would be whenever you go for the exam, your idea should be any question in which I can eliminate one option and answer is among the three options, remaining three options, I should definitely attempt that question. That should be your goal. Still, having said that, I would say around 190 plus or minus 5 would be a good attempt out of 200 questions. This is what you should target. Now, and in this, again, what I'm saying is, see, whenever we make a question, you'll realize that, see, for example, if I have to make a question, and whoever makes a question for that matter, let's say I want to make a question on fluctuating weakness. And if I'm talking about fluctuating weakness, let's say you have myasthenia gravis, Eaton-Lambert syndrome. I know that I want to make a question towards myasthenia. Then the problem comes, okay, I've got one answer, then I should have three important differentials. Okay, I've got another important differential, Eaton-Lambert, that also comes with fluctuating weakness. With difficulty now to search for two more options. Maybe I can think of rare disease like say botulinum toxin. That also can come with fluctuating weakness. What do I do with the fourth choice? I don't have any other disease that I can add over there. So I'm going to add something like muscular dystrophy, Duchenne's muscular dystrophy, something like that. Now, the moment you see a weak choice, your job is to identify it and eliminate it. If you can do that, then you got a 33% probability of getting that question correct. Once you are in that zone, after that, even if you randomly guess, you're still going to have an advantage when you attempt that kind of questions. So this is all worked out mathematically in the sense don't under attempt and come. And as I keep telling, those who under attempt and come really have a lot of regret. And I'm in so many years, I think as I was telling you, this is my 25th year now. Dealing with these kind of things, and I can tell you, very few people I have come across in my life who have attempted less and got a great rank. Generally, if you want to get a good rank, you should have a good number of attempts. Otherwise, don't think about negative first. You think about positive. Unless you don't have a positive score, negative comes much later. So make sure that you attempt nicely. So in general, the principle is कि in a NEET exam, if you can eliminate one option, better to attempt that question. In INICT, it becomes more, you have to be more cautious because its negatives are a little higher. So if you can eliminate two options, then it becomes more safer for you to attempt. But in general, your ultimate thing should be around 190 plus or minus 5 based on the difficulty levels of past 3 years. I'm saying yes, you can get a very exam sometimes, easy exam, sometimes you can get a very difficult exam, but generally this is the ballpark I think that you should aim for.
Yeah. And sir, my idea is I always say that if you did not get a good score, it is not because of more negative, it is always because of less positive. So always think of increasing the positivity in the life, in the exam, everything. You should always think about more positive thing. And if you have too much positivity, negativity will automatically be reduced. So that's the simple philosophy with which I live. And
True,
if
very
you
much
are in
true.
front of me, that positivity comes more and more in me. So, sir, without wasting much of a time, I have a second question for you, and that is, what are the mistakes to avoid while preparing for the exam, and similar to things to remember for revision plan.
See, for these kind of exams, the primary pillars of preparation have not changed for so many years. The time tested technique remains the same, and that is you have to do three revisions. You have to first let's look at the pillars. The pillars of preparation. First of all, you should have your notes in order. That means your class notes or whatever videos you have seen, you should have your notes in your hand. Number one, that's you're going to be your backbone. Number two is previous year questions. Don't go for any exam without previous year topics because that is the main guiding light for you as to what you need to prepare. The third is grand test. These three pillars are your primary pillars of entrance preparation. Once you are done with it, then after that comes question bank. Then if you still have time, then you have USMLE step 1 first aid. If you still have time, so you can keep on extending after that. But the basic three pillars you should not avoid. And in these, I think there are some mistakes some people do. One is they don't start doing GTs until they complete their preparation. I think part of preparation is giving GTs very early on. Now it's kind of established that Marrow is now the benchmark now, and I think if you keep doing and a large scale, you get an assessment of where you are in the GT. So I think giving GTs very early on, giving it regularly, and I would say a healthy habit would be to give a GT at least once a week, and every Monday or every Wednesday you do a GT, and then solve those questions throughout the week. That would be a healthy habit. But however it works out for you, if you can do a GT and then just do the mistakes and where you're guessing, that also is fine, but better is if you have a go through of all the questions. If you can, that will definitely be beneficial. So in general, to repeat, the three primary pillars of preparation are your notes. Repeated revision of those notes obviously is going to be the main thing. Second thing is the previous year questions. Whatever custom modules you do, focus on previous year questions and make sure that you are focusing in your notes also on previous year topics. Third is GTs. These three main things. If you have time after that is the question bank. If you have time after that is the USMLE step 1 first aid. So all these come much later. So this is in brief about what you need to do. Now, as far as what mistakes people do, one of the biggest blunder I think people do is in the revision phase. When they start revising, they keep watching videos. It's kind of a casual way of preparing. Watching videos 1 month before the exam and not reading the notes, not recalling the notes, I don't think that is going to help you. Sometimes the thing is, people all the time they're watching videos, they are not having time to recall, they're not having any notes in front of them. I think those are going to be not time tested. It may work for some very rare person, but I don't think that's the correct technique to do. Once, you should have your notes in your hand, you should read them, you should recall those notes, you should do questions, and whenever you have a doubt in any question, you should go back to those notes. That's the correct technique. Rather than watching too many videos, I think before the exam may not help. Once you see a video, you made your notes, I think that should be good enough. Repeatedly watching any video is not the correct way. It will not improve your memory or your answering ability for any question. So I think that's the biggest mistake that one should avoid. Secondly is getting stressed out before any exam. I think that's another major issue. I think staying calm is something that you have to practice. In this regard, I would say even if you're targeting the NEET exam, do prepare for the INICT. One exam comes, and if you can handle the stress before it, then you're mentally more. See, the only correct way to overcome stress is to get repeatedly exposed to it. The more you get exposed to the stress, the better you're prepared for it. So one is you create mock exams that simulate like actual exam in your mental mind. I mean, you should have a thing that is the main exam that I'm going to give. So keep some mock exam as your main exam. Then like try to create a simulation, and then finally give the INICT exam. And once the INICT exam is over, you'll face thing, and then I'm sure after that you'll be better prepared for the NEET exam. So I think more exams, repeatedly exposure. That's the main thing. So these are the things that you should avoid. What you should do, I already told you, repeated revision of your class notes or your notes, whatever you made. I think that's going to be a benchmark.
Yeah. So, sir, I have just summarized it and shared it. The essential things to crack the exam is thorough subject knowledge by making the notes, attending the classes once, and avoid watching it again and again. It's the revision, practice questions, and simulate paper, right? So, this is an area that you should focus upon. And ultimately, it's about subject knowledge plus logical thinking, which is equal to correct answer. And as sir has mentioned, that you should do repeated revision, you should have a discipline in your preparation, and a very, very important aspect is you should have confidence. And obviously, confidence will come once you're going to be solving more and more paper, once you'll be simulating the GT. So, sir, a question linked to this is how to assess GT. How to assess my GT score. My GT score is fluctuating a lot. This is a very, very common challenge that a lot of student faces. It gives them a panic reaction. There are a lot of students who are stuck in a loop. They are in a mid preparation crisis. I mean, they are unable to complete their, or they have completed their studies, they have prepared their notes, but they are unable to score well in the GT. They do not know how to assess that GT in the right way. What is your advice to those students?
Yeah. See, in this regard, I would say there are two issues. One is, have you started your revision? Have you finished your first revision? If you have not finished your first revision, your focus should be to finish your first revision as fast as you can, because once your first revision is over, your GT scores are automatically going to improve. Whatever you do GTs up till that time, until your first revision is over, it's just going to increase your overall knowledge. So don't get too much pulled down by it. It's not going to be much impactful. I'm sure once you start doing your revisions, your GT scores definitely have to improve. Secondly, there are some people that I've seen that once their first revision is over, they're giving the GT and they are starting with the second cycle of revision, but still their score is not improving. Now, this is a very common problem I've seen nowadays. People are saying, sir, I'm doing everything right, but I still find that my GT scores are not improving. Now, whenever you're doing that kind of a thing, I would say there are two things that you can do in this. One is, whatever questions you are attempting, when you find that you made a mistake in any question, in that particular question, find out what you have selected. What is the answer you have selected? Generally, the choice you're getting attracted to, the reason why you're getting attracted to that choice is because you have insufficient knowledge about it. So, in the differentials between two choices, most of the game in our entrance exams is about differentials. So, the more control you have on the differentials, the better you are equipped you are in answering these kind of questions. So, whenever you are getting attracted to a choice, find out what choice you are getting attracted to and know about it. Sometimes QBank highlights, or a question bank generally highlights more about the correct answer. Do spend some time, although they will give it. Sometimes we don't read it. You have to read about the incorrect option also. The choice that you're getting attracted to, read about it. It will help you to prevent, it will help you to avoid that choice next time. That's one. Second important thing, the one of the method that really works is, every GT that you give, find out 5 subjects that you're losing marks in. If you start creating a 2 hour window period just for those 5 subjects, that special preparation you should do only for those 5 subjects. The rest of your revision continues, but 2 hours you have to create just to prepare for those 5 subjects that you're losing. The next GT will come again, you will find 5 subjects that you're losing marks in. Again, you work on that. So it's a cycle, it's a constantly you have to keep at it, and you have to keep finding your weaknesses and keep working on it. And that's the only correct method to keep improving. So give a GT, find 5 subjects you're making mistakes in, work on those 5 subjects in a special 2 hour everyday create a 2 hour slot for that particular 5 subjects. Then next GT comes again, 5 subjects, find them out and work on it. So it's repeatedly working on your weaknesses. I think that's the main way how you can improve.
Yeah, very, very rightly said, sir. Sir, another question that I am repeatedly getting from a lot of students is that uh, we all talk about consistency, we all talk about discipline, and once the students are attending the classes, it is relatively easy to maintain the discipline. But once the classes are over, now they face two challenges. The first challenge is that the classes get over for different student at different time. Some have finished slightly early, some are at their last classes even today, when they will be finishing in next 5 days or 7 days, or they will be finishing in the first week of February. So a lot of time they get anxiousness that one of my friend have finished the course pretty early. So this is one. The second is that once the classes are over, then how do they maintain this consistency and discipline? What's your advice to them?
So I think there are multiple methods. If you can study on your own, and if you are getting involved in the process of making the revision timetable, you'll be so involved in just completing that itself will keep you occupied. Some people are unable to do that, and they need some kind of a structured program to keep them going. And I think this is where the TNDs come into a major role. So I think TND sessions can really boost up your preparation for this. So sessions like one shot, sessions like T&D, they are going to add like a thing, they are really like steroids. They're just going to amplify your preparation better. Then I think ultimately it's all about your persistence, your dream. You must have a high dream. You must aim for something big, and you should work on trying to make that dream come to a reality. And I think it's all about that passion that you have, that fire in the belly, as we keep saying it. And people, when you see in the classes also, sometimes in the students' eyes, we can see that kind of focus. And once that focus, when you see, you realize, okay, this person is really focused, and they no matter what, they're not going to give up. They are going to push themselves up to the limit. So I think ultimately, no matter what the road you choose, the method you choose, ultimately the ones who are successful are the ones who really are very passionate about what their dreams are about, and they are trying to make a sincere effort to fulfill them.
मतलब कुछ बच्चे होते हैं जो जिनको जब मारोगे तो ही पढ़ेंगे वरना नहीं पढ़ेंगे. So just for the DBMCI students, I want to inform them that all the students who have finished their first reading or completed the classes, the structured schedule for the revision have already been prepared. There are multiple schedules that have been prepared depending on when you are finishing your course, in a way so that you are able to finish 3 readings, right? So reach out to your center in charge, and they will tell you that how to access those. You can get completely disciplined, structured revision material, or along with the daily test also, which can keep you on track. However, in spite of this, if you are unable to maintain on the track, we are starting the fast track T&D program also from 3rd of February, so that you become more structured and more focused. So that, as Dr. Thameem has mentioned, it completely depends on the level of discipline that you have from within, right? How you are able to maintain that consistency. Do you need an external force to maintain that consistency for you, or you can maintain it at your own? The net result is you have to maintain that consistency, you have to maintain that discipline from within. And no matter anybody else is pushing you, somebody needs slight push, somebody need more push. It is something like there is a river. You need to cross that river. You know swimming and you can cross the river. You do not know swimming. You might need a help to do that. So it all depends on your persistence level, on your discipline level, and you are the best judge for it. Please remember, nobody else is the better judge. You are the best judge for it. That how much support do you need? How much hand holding do you need? And according to that, choose a wise revision plan for you. According to me, doing the ultra short revision program like one shot, as a student has written, should be done very close to the exam, when the exam is not 5 months away, probably when the exam is 2.5 months away. That's a time when the must forgettable stuff should be done. At this time, you should focus more on revising your notes. The first thing that you're going to look at while you will see that your notes, the first thing that is going to come to your mind, oh my god, they are too bulky, what should I do? And it's a normal human tendency to jump to something which is less bulky. But please understand that if you don't want to revise your notes, just give me one answer why you have prepared it at the first go. When you never wanted to revise those notes, then why you have prepared it? Why you wasted your so much time? So please, I have a very, very sincere request for everyone that during your first revision, please revise those notes. You will be revising them. You will be having a lot of panic attack that you have forgotten a lot of stuff. But please remember that forgotten stuff is not 50%. 50% you will be able to remember. Once you're going to revise it, it will become 60-70%. Once you're going to revise them again, it will become 85 to 90%. And this is the consistency that we are talking to all of you. And this, if it will be backed up by the questions, I can tell you that nobody can beat you in getting a rank that you're looking for. Nobody can touch the dream that you have seen once you have started this preparation, that with the thought that this is what I am aiming for. I am aiming for a medicine seat at All Institute of Medical Sciences. I am aiming for a medicine seat at Kottayam Medical College, or radiology at Bangalore Medical College, or whatever dream that you had lived at the beginning of your preparation is definitely gonna come to be true. Sir, I have a very tough question for you now.
एक क्वेश्चन मैं देख रहा हूँ रजत. दिस
Yes.
इज फ्रॉम किरुबा करण. ही इज आस्किंग, लास्ट मिनट वी कीप चेंजिंग द ऑप्शंस. What do you suggest about that? and overthinking. So, see, when you are looking at a question, the moment you see a question, you realize ki either it's a conceptual question or it's a factual question. A conceptual question, like in medicine, generally most of these are case histories they give you. They'll ask you the scenario, like you have a patient who's got a plasma cell disorder, a monoclonal spike is there. Is it multiple myeloma? Is it Waldenstrom's? So that's a conceptual question. You have a factual question, like you got Bigelow's ligament is present in knee joint, ankle joint, hip joint. It's just a factual question. Whenever you see a factual question in the exam, first feeling that you get, mark the answer based on that. Do not mark the answer question for review. Now you must understand both NEET and INICT both are basically Tata consultancy, I think, if I'm not wrong, who are conducting it. But AIMS believes that, I mean, AIMS institute, the institute believe that their students should be more accurate. They should not be having doubt about their answers. So any question that is marked for review in INICT may not be counted. In a NEET, even if you mark it for review, that may be counted. So in general, when you're going particularly for the INICT exam, a factual question is not a good option to mark it for review at all, because you know the answer, you don't know it. If you know it, then you're going to first feeling that you get, you stick to that and you mark it. In general, we have tested this out that once you mark the question, if you keep staring at the question later, generally the other three choices look more attractive. Something else will look more attractive than what you answered. When you change the choice, possibility of going wrong is very high in a factual question. So better not to mark it for review, better not to look at it again and review it. You're just going to make a mistake. So that's for factual. If it's a conceptual question, sometimes the first time you look at it, it may not strike you. Next time when you come back, you'll realize that either you forgot to see the except in the question, or you misread it as an except, it was not there, or you found some idea that you could not recollect earlier. So a concept sometimes comes back to you later. So in a conceptual question, you're allowed to go back and change the answer if you want to look at it. You can mark it for review. A factual question should never be marked for review. That generally is one of the some basic things that you should know. So last minute, you should have every block, you should have a target ki these are number of questions I'm going to do. And sometimes, if you're unlucky, if you get a bad slot of questions in the first and you end up leaving more questions, it's going to put a lot of pressure for you, because at the end of it, your goal is to, out of 200 questions, you're going to aim for around 180 plus questions you want to attempt. So you have to have in your mind ki what questions do you want to leave. And all these basically is practice, and repeated practice only comes by doing lots of GTs. So the more GTs you give, the more confidence you're going to get. It's going to be just like another exam when it comes for you. It's not going to be something new. You're going to be used to that experience. Rajat.
Yeah, so sir, you will be surprised to know, sir, this is the exactly same statement that I also mentioned. A lot of time when the statement is being asked that whether to change the answer or not. Maybe I am your student, so probably this is the same statement that you must have told me when I was a student. Sir, I have another tough question for you, but I will answer it partly. And the question is 5 months enough to get a good rank? Now there are two portions of this. The first is that if I have completed my first reading, I have attended the classes and I have made my notes. And second, if I am starting now. So, sir, I want to answer the first question of this. If you have completed your classes now or are about to finish it, I can tell that this is 100% possible to get a rank, a good rank in the exam. But the problem is there is no definition of a good rank. Everybody has its own concept of a good rank. I believe a good rank is the one that helps you in getting a clinical seat in a government college. This is my definition of getting a good rank, but everybody might have a different definition for a good rank. But a rank within 500 to 1000 is definitely possible if you focus for the next 5 months very thoroughly. But so now the difficult question is for you. If I am starting now, can I get a good rank?
Yes, absolutely. I believe it's very much possible. Now, again, it depends on two situations. Are you an intern in a very busy department, or are you completely free and you can totally dedicate 10 hours every day? If you can put in 10 hours every day, I think you're in the game. You're very much in the play. If you can just look at the revision videos that are there, the revision videos are not as extensive as the actual thing. So the revision videos, or if you've got some notes already made in your UG, so revision of those notes. Again, the same principles, previous year questions and GTs, you are in the game. But there are some people who are doing internship and they might be having busy, hectic internships in certain colleges in Delhi, in Bangalore Medical College. The internship is hectic. So if the internship is hectic, then what I would suggest is during your posting, as many questions as possible you should try to finish. And when in the evening when you're free, that's the time you should try to read theory. So in the postings, questions should be done. In the when you're totally free, you should start doing theory. And this is the only way you can do it during a busy internship. There's nothing else you can do about it. But I think even with good amount of questions, you keep getting some knowledge. And as over a period of time, you'll start realizing that questions are going to be basically one of the most important tools that will help you to improve your knowledge significantly. So as far as those who are totally free, I think the plan should be your goal should be to finish your notes as fast as possible. Remember, even if you do just the revision videos that are there, and these revision videos that we've done, I think for me, medicine, I think the actual main videos are more than 140 hours, 160 hours, I think. But the revision videos have covered medicine in 25 hours. And I think at the end of it, when I was doing the revision videos, I myself felt some kind of satisfaction. And sometimes rarely you get that kind of feeling. Yeah, I think they really have come out good because I've covered all the high yield topics. I've covered all the the tricks they keep asking in exam, the differentials, what you should watch out for in any topic. Like laser guided, we say no, this is the point that you're focusing on in the exam. And this is my experience from so many years. I was just trying to add all that in those kind of sections. So I think revision videos is one way. Then if you have still any weaknesses, one shot videos, do that. Get your notes in order. Then start the 3 revision cycle. If you can at least do 2 revisions, and even if you can do one proper revision before the INICT at least, I think that means you're still going to be getting a decent rank. So I think there's always a possibility you can get through this year itself. So why not give it a push? And worst comes to worst, if you don't, then at least all these effort that you put is not going to get wasted. And one of the things you'll realize in this entrance preparation is any long-term preparation. Sometimes I've seen students and they're telling me, sir, this year to gaya, abhi in 5 months I can't prepare. Let me prepare for 2026. Any long-term plan by itself is a disaster. It's going to fail. The correct technique is short cycles, faster revision, intense preparations are more important than long-term plan preparation. In this kind of system, if you're planning for a 1.5 year haul, you're definitely not doing a proper method of preparation, and that is not going to get you anywhere. Neither here now nor in the next exam you're going to do well. So short cycles, intense burst of preparation, I think that's what is going to get you the results.
Sir, but I also want to add one point because it has become a taboo nowadays when the people think about that it's a sin to drop an year. And they have to get it into the internship year, no matter how it happens. I believe that you should be able to reach to the highest of your potential. And getting a half-hearted preparation and getting a half-hearted rank and then taking up a seat which you regret it after 6 months and after 1 year and then dropping it and then going in a limbo. The much better thing is it's absolutely okay. Long run, nobody is going to ask you whether you're joining a post graduation in at the age of 24 year or 25 year or 26 year. It does not matter. All that matter is that how much time do you have? Are you satisfied with your preparation or not? And you should pick up a branch when you think that this was your best attempt. A half-hearted attempt is a problematic attempt a lot of time. So if you have not studied well during your MBBS, if I mean you were a student who have just read for last 10 days before the exam and barely passed, then the 5 months, according to me, are not sufficient for you. If you have read pretty well during your MBBS, you were decently regular. I will not say that you were, thorough, very thorough, and you have covered every coaching institute app or everything. No, you were pretty decent with your postings. You were decent with your class lectures. You were not a topper, but you were regular in your classes. Then it's definitely a worth to put efforts into this. But you have passed, you were having a lot of panic attack during your MBBS, you have not studied pretty well. 1 year of a sound preparation is a much proper, better plan. Preparing for November INICT is a much better plan for you, but you can still try to give it an attempt for this. So that is how I am probably gonna take it. I can say this, yes, no. In the 3 months, you can move everything and you can change it, but that can definitely be possible if your basics from MBBS have already been covered. Covering your basics in the next 2 months, then revising it, then solving the MCQs. Let us be very practical. बेवकूफ नहीं है वो लोग जो पिछले 4 सालों से पढ़ रहे हैं और आप सडनली 4 महीने पढ़ के एकदम टॉप 100 में रैंक लेके आ जाओगे. That cannot. I mean, there are few gifted people who might can have that, But if you are amongst those, you don't have this question, right? That's a very, very simple point. My apologies
Totally.
if this statement has hurt anybody, but this is not to hurt, but this is actually as a teacher to show you the real point. Nobody asked my age. Please understand this, that at what age I started my post graduation, right? So you should do your best possible preparation, that when you are going for the exam, you can say that this was my best attempt. That's how I'm gonna take it.
Totally agree with you, Rajat. I just want to add a few points here. See, if somebody does surgery, let's say in a college that is not that great, a new college where hardly any patients come, 5 years down the road, when you're alone and you see that particular complication and you don't know how to handle it because you are not exposed to it during your post graduation, you will just start sweating. Now it's a WhatsApp zamana. People in front can see that you can't handle, you are not capable, and very soon everybody is going to crowd is going to gather and you just don't know how to handle. So the point I'm trying to tell you is ki, particularly skills like anesthesia, like surgery, like orthopedics or ophthalmo, most of the surgical subjects particularly, unless you're really exposed in an extremely good postgraduate program, you're not going to have the confidence. So everybody's in their own timeline. And nobody's going to ask you when you're a cardiologist or a vascular surgeon or whatever, when you started PG, what happened. So everybody's in their own timeline. Better not to compare with anybody. Your own batchmates might have got through already. It may take some more time for you, but eventually you may achieve much more satisfactory results. So I think you need to focus on your satisfaction. You need to focus on, are you getting into the best college that you, and is this the best attempt? I think that the way Rajat put it is absolutely right. You just should have that satisfaction ki, this was my best, I could not have done more than this. Between what we can do and what we are going to do, there's always a gap. But if you feel that gap was very narrow, you really give your all out, your best, I think that's what justice, you have done justice to your what was expected from you.
Sir, sorry, few more questions for you. um, um, how to make 20th notebook?
So I think 20th notebook, I have come across many methods nowadays. Students are really very smart. Interesting new aspects that I'm seeing nowadays is people are making WhatsApp groups and clicking all important parts of the notes and putting it and sending it as a WhatsApp group. And every topic that they think are like that they at the end of the day, in the night just before going to sleep, just one rapid revision of the subject that they're revising currently, or looking at all the the 20th book, whatever they have added, that thing, that's one method. The other method is if you can highlight it in your notes and put sticky notes, that's another method. And highlight should be basically focused on previous year topics. The third is to actually make a 20th book and write all the volatile stuff in it separately. So the three aspects to it. The very intensely hardworking people who have sufficient time and they're already in the revision phase now, I think if they can make the 20th book, don't I mean, always you'll have a feeling ki instead of making the notes, I can read more. Shouldn't it be a better usage of my time to read than to make notes? I think you'll be always finding it very, very beneficial if you have a separate book in which you can go back to, and you'll find it very useful, particularly the last 20 days, when you're revising. If you have everything assembled at one point, it's going to be a big boon for you. So if you know all the CD markers, yeah, if you know all the sections, all the the forensic rigor mortis, what will start first. So all the volatiles basically, or the enzymes in like Hurler's disease, Huntington's, Hunter's disease, Gaucher's disease. So you got everything organized at one point, and I think that's going to be an amazing tool for you to revise. So that effort you put in making that book separately, it'll not take much time if you're doing each subject that you're revising. If you keep adding it at that time itself, I think it's going to be not that difficult. Yes, if you sit down to make a separate 20th book, it's going to be troublesome. But I think as you're revising, then and there, if you add the points, I think that should not be a difficult task.
Sir, my 20th
So
notebook was your SRP notes that you gave me during my internship. For me, that was my 20th notebook. I mean, I wish that you would have been taking this for the students. I mean, I will request on behalf of all the students that if you help, maybe obviously not now, but maybe try to take out some time and help them in creating. But as a group, as the group of 19 students, we have tried in one shot that all your forgettable stuff has been created in the form for your 20th notebook. Since a lot of you are messaging over here about the timing. So if you are from Hyderabad, if you're from Bangalore, if you're from any other part and you could not complete the one shot program at that point of time, please reach out to the center head and let us know. If you want more booklets, we will print it and we will provide it. But you have to let us know that how many of you need it, and then accordingly I can try to get another set printed for all of you so that you can attend the one shot in the same way as the students have done. But I'm very, very confident that if you have not created your own 20th notebook, one shot book can help you as a last minute revision substitute for it, right? So before we go to the last few questions, I am once again telling you the 5 months is an extremely, extremely important time for your preparation. Your first revision is the biggest key. When you get a maximum improvement in your GT score, it becomes very, very difficult to maintain the discipline. You have to maintain the discipline. If you are a DBMCI student, please reach out to your center heads and they will tell you how to get the customized schedules that we have prepared for you. You can join us at the morning sessions that we conduct for all of you, and you can just reach out to your center head and they will tell you how to do that. But if you think that you are unable to get into the discipline, we are planning to provide you the TND programs. Please comment on this or reach out to student support at DBMI how to get access to the TND programs. I mean, that's a very, very nominal cost that has been given for that. And you will be able to finish your entire course with test, with GTs in 3 months. And the validity will be up to 30th of June. The course will be starting from 3rd of February. And then obviously the one-shot program that we have for you. Sir,
Abhishek is asking about where can he find the revision videos. They are there in the DBMCI One app.
yeah, they
Okay.
are at DBMCI One app. The
DBMCI One app.
videos are available, yes. Um, Sir, I have few more questions if you allow.
Please.
Sir, there are students who are attempting the exam for the second and third time, and they have already completed the revisions. Do you think that a TND program is useful for such students?
I think CTND is can be beneficial for anybody, and I don't think it's going to be time consuming. It's going to be an advantage only. I mean, there's nothing, no harm in it. But ultimately, I think the people who are repeating second time, third time need to ask this question: "Ki what went wrong in the first two attempts?" And they need to find what their weaknesses are and focus on them. Sometimes, we are so much into factual learning, and how much of a factual stuff you are going to add, it's not going to ultimately give you that power to answer conceptual questions. In the NEET recently that we saw, I think the way the questions were framed, unless you have depth of knowledge, unless you have logical conceptual approach, whatever memorized stuff is there may not be able to help you to answer those kind of questions. So if you sometimes, people the entire year they are okay, they just before the exam they just do some shortcut thing and they try to get through. I think that was okay during the COVID time because the questions were very easy and the pattern of questions were very, very different. I think they're back to how they've been asking standard questions, and the kind of quality of questions in NEET now and INICT does need the student to reflect into the subject properly, to focus into the concepts and build them up properly. But in every TND also where we are discussing, we are trying to give the concept, we are discussing the tricks of how to eliminate options. So I think there's no harm and it's not going to be a disadvantage. It's an advantage only. But then my point is that fine TND is there, but what else they need to do is really reflect on where they're going wrong and work on it.
So, sir, with your permission, I am just showing a broad TND schedule that is there for the students. So it will be starting from 3rd of February, and it will be the anatomy test, which are 3rd and 4th of February. The discussion will be from 2 to 9 p.m. Then followed by medicine, the discussion will be 4 to 9 p.m. Then surgery, PSM, pathology, obstetric, gynecology, FMT, micro, radio, physio, orthopedic, pharmacology, anesthesia, psychiatry, dermat, biochemistry, ENT, and pediatrics. And by uh, uh, the 6th June, that you will be finishing on them. If you're able to finish your subject slightly early, then you can back it up with a revision or any forgettable stuff that you have for this. The minimum
Yeah.
GT that we believe that you should do is once in a week GT. And if you think that it is too much, then at least one GT in 15 days that you should definitely write. Yes, sir.
Okay, Vardhan is asking a question. Do we need to do the entire Q bank? And here, I think I would say you need to focus on doing the custom modules. You need to, I think, focus on doing the previous year topics. And any question in which more than 50% of students have got that question correct, you should address that question. So those kind of questions you should not lose. Some question that is hardly getting being answered correctly by most of the students are marking it wrong. But the ultra difficult questions may not really be the ones that will make an impact on your preparation or your rank. They are for the people who are already in that top zone. But I think for most of the students, I think they should focus on looking at the previous year topics primarily, and then once previous topics are over, then like create tags like INICT or NEET previous year NEET questions, and create your custom modules and prepare on that. So I think that is the best way to do the question bank. Entire question bank is not the ideal thing unless you've done already the first three pillars. The primary three pillars I told you is your notes should be in order. And you should have started revising those notes. Number two is previous year questions. Number three, GT. These are three pillars. Only then comes question bank. Only after the question bank is like, you've done to some satisfaction, then comes the USMLE step one. Particularly in the USMLE step one, I think the biochemistry part, if you can read, I think that's going to really boost your preparation, particularly the biochemistry part. So I think these are the steps. I mean, there's no end to how much out of 2.5 lakh, I think maybe 2.4 lakh that will be giving the exam. There must be some reason why you're going to get the seat. So there's something additional you might need to do. So the more you do, the better. But the minimum that is time tested, that has shown results consistently, is notes, previous year questions, GTs. This is your base. After that, anything additional you do definitely is going to benefit you.
Yeah.
But all that comes additional later. First, you finish the basics.
So let's do it as a question. I want to answer that. It says that TND or revision by myself. See, I believe that the best way to study is self-study. There is no doubt about it, right? You can modulate your own working hours. You can play around with this, but will you be able to maintain discipline? If the answer for this is yes, please go with it. There is no doubt about it, right? Now, always say what is the best way to study is textbooks. There is there cannot be a substitute for a textbook. Are you getting it? But will you be able to do it? That's question. If you're able to do it, I mean, if you have read the standard textbook during your MBBS, you're bound to get a good rank. There is no doubt about it. Now, a lot of times, student ask me, sir, why interns in the top 100 ranks, we see a lot of interns who are there. It's only because they were regular during the MBBS. But sir, does that mean that I was not very regular during the MBBS? That means I will never be able to crack the exam. If anybody says, no, you will not be able to crack, I differ from it. I have done that. I'm telling you, not for the PG, but at many other exams. If you focus one complete year of your preparation, you dedicate your 1 year of your preparation, 9, 10, 11 months of your preparation, you are bound to get a great rank within top 10, within top 1,000 without a doubt. But you have to work for it. I always say that for that next eat, sleep, read, repeat is the only thing. I still remember Dr. Thameem's statement, they echo in my ear, which says, if next day you are not thinking that how can I work so hard? If that is a statement that is not coming to your mind, that means you have not worked hard. That means you're not serious with your preparation. Sir, what do you say about this particular
Absolutely,
statement that you
absolutely
have
agree
mentioned
with you.
multiple times? I remember.
Absolutely agree with you, Rajat. I think you have said it correctly. Before I answer the that question you're asking, I just want to finish what Harshvardhan is saying. He's asking, sir, can medicine be skipped as micropathophamac is going to cover it? See, I think the non-overlapping area of medicine is endo, cardio, and neurology, which not much is covered by pathomicropharmac. If you can do these three parts of medicine, rest of it, I think to some extent is overlapping with other subjects. But in that also, I would suggest if you can do the revision videos that we have created, 25 hours in medicine, I can tell you, you will have a good confidence कि most of the stuff. And I was looking at those revision videos. I think we've discussed not just about the topic, but also about the tricks of what you should avoid, what you should focus on every topic. So I don't think it'll take too much time. But as I said, if you can even do endo, cardio, and neuro, that's non-overlapping areas. Rest of the overlapping zones, I think you can manage with pathomicropharmac knowledge also.
Sir, you are
So
mentioning about the revision video. I also want to make a confession here. So my revision videos are only for almost 4 hours. And when I recorded those 4 hour video, I realized that I have covered almost every part of the class that I take for 25 hours. So, I mean, that definitely will act as a very, very good boon in your preparation.
I
If you
think Rajat,
do not have a confidence in the
I
subject.
think teaching so many years and years, I think we found a method of what really is focused and what they're asking. That's
Yeah.
why I think we are able to cover the revision videos in such a compact mode.
All right, guys. I think I mean we can keep talking on this. There is no limit to this, but I think you also have to study. We have tried to cover almost every point that we have. I am just gonna summarize it. Please be consistent. Please be disciplined. There is very simple rule, and that is you have to revise your notes, you have to practice questions, and you have to simulate exam in the form of GT. You have to identify where are you going wrong in the GT. You have to pick a bottom five subject, and you have to make sure that 2 hours in a day you are focusing on those bottom five subject, and the next GT those subjects should not be in the bottom five. That's all. That's a principle that which you have to follow, right? Try to maintain discipline at your own. If you are not able to do that, we are there for you, right? We have every kind of opportunities for you depending on what kind of help that you want, right? One size doesn't fit all. Somebody is doing this particular point does not mean that you also have to follow the same thing. The tried and tested method is please revise your notes. Please revise your notes in a disciplined environment. Please make a schedule for yourself. If you're unable to do that, reach out to us. We will create a schedule for you. Try to follow that schedule. If you're able to follow that, best thing. If you're unable to follow, reach out to us. We will give you TND. Right. If you're able to follow the TND, well and good. That's the best thing. If you're unable to do that, reach out to us. We will customize it for you. Right. At whichever step in your preparation, you need a support from us. I can tell you that we are there for you because that is what we do. This is what we are doing. Sir is doing for 2.5 decades. I'm doing it for 2 decades. Now this has become our life. We are. I mean, every day this is what we think. How we can make your life better. That's all. That is what we are thinking. Try to do it yourself. If you are unable to do it, do let us know. We will try our level best to provide you support in the best possible way that we can do. That's all from our side. Thank you very much for your patient listening and asking your doubts. Thank you very much, sir, for
Thank you
uh,
so much.
taking out your time and joining me on this particular session. Looking forward to meet all of you and to help you as much as possible from our side. Take care and may God bless you all.
Thank you.